Hi everyone, hope you are doing well, all of you guys. I'm Dr. Emily, a family medicine physician, and I'm so glad you're here with me today. In today's episode, I want to talk about an issue that I get asked about a lot, and this episode is very important for those who cares about their dear older ones, and also important for the older adults. It is something that affects older adults very often, especially in the warmer months, and that is dehydration. So specifically in today's episode, I want to talk about what is dehydration, what does it mean to be dehydrated, and then I want to talk about the common causes in older adults and why older adults become more at risk as they get older. I'm also going to cover signs and symptoms of dehydration, how it's diagnosed, what are the consequences health-wise, how to treat it, and then I'm going to end with tips on hydration prevention, and also a couple of suggestions about managing hot weather. Older adults do get dehydrated when we don't have particularly hot weather, but it's also an issue that comes up a lot in the summer months and when there are heat waves. And so, I'll speak a little bit about what to look out for during those times as well. So we're going to get to all of that, but before we do, I just have a very quick request, which is that if you are here and you find this topic interesting, or you've been finding my video podcast interesting, if you haven't subscribed yet, could you please go ahead and subscribe? It would mean a lot to me. It really does help me out, as it helps other people find the channel when you subscribe, and it does help support the work that I'm doing. So thank you so much in advance. What is dehydration? Moving on, what is dehydration? So dehydration fundamentally means that the body does not have enough water to function the way it should. Our bodies are made up of around 60% water. And water plays a huge role in almost everything our body does. It helps regulate body temperature. It keeps our joints moving smoothly. It carries nutrients to our cells. It helps flush out waste, and it even helps our brain work properly. When we lose more fluid than we take in, the balance gets thrown off, and that is what we call dehydration. Now, dehydration can be mild, moderate, or severe. Mild dehydration is often easy to fix with a glass of water and some rest. But moderate and severe dehydration, especially in older adults, can become a serious medical emergency that may need a trip to the hospital. So this is not something we want to brush off as a small thing. It really does deserve our attention. Why older adults are at higher risk. Now, let's talk about why older adults are more at risk of becoming dehydrated. This is something a lot of people don't realize, but as we age, several changes happen in the body that make dehydration more likely. First, the sense of thirst naturally decreases with age. So, a younger person might feel thirsty quickly when their body needs water, but an older adult may not feel thirsty at all, even when their body is already running low on fluids. This is a big reason why so many seniors get dehydrated without knowing it. Second, the body's ability to hold on to water decreases. The kidneys do not concentrate urine as well as they used to, which means more water is lost through urine. Older adults also tend to have a lower total body water content compared to younger people, so even a small loss of fluids can have a bigger impact. Third, many older adults take medications that can increase fluid loss. Things like diuretics, which are often called water pills, blood pressure medications, and certain laxatives can all pull more water out of the body. If someone is taking several of these, the risk goes up even more. Fourth, mobility issues and certain health conditions can make it harder to drink enough water. For example, someone with arthritis may find it hard to get up and pour a glass of water. Someone with dementia may simply forget to drink. People with swallowing difficulties, which we call dysphagia, may avoid drinking because it is uncomfortable. And some older adults limit their fluids on purpose because they are worried about incontinence or having to get up at night to use the bathroom. Fifth, chronic illnesses like diabetes, kidney disease, and heart conditions can also affect fluid balance. And when an older adult gets sick with something like the flu, a stomach bug, or an infection, dehydration can happen very quickly. So you can see there are many reasons why older adults are more vulnerable. It is not just about drinking less water. It is a combination of how the body changes, what medications are being taken, and what daily habits look like. Common causes of dehydration in older adults. Let's go a little deeper into the common causes. The most obvious one is simply not drinking enough fluids throughout the day. Many older adults sip a little water here and there, but do not come close to what their body actually needs. Another common cause is illness. Vomiting and diarrhea from a stomach bug can cause rapid fluid loss. A fever can also pull water out of the body through sweating. Infections like urinary tract infections, which are very common in older adults, can lead to dehydration as well. Hot weather and heat waves are another major cause. When it's hot outside, the body sweats more to cool itself down, and that means more water is lost. Older adults often don't sweat as efficiently, which means their bodies can overheat faster, and dehydration can come on quickly. Certain medications, as I mentioned, are also a big factor. If you or a loved one is on water pills or other medications that affect fluid levels, it's worth talking to the doctor about how to balance hydration safely. And finally, some older adults are just not eating much. Food actually provides a lot of our daily water intake, especially fruits and vegetables. So when appetite goes down, fluid intake often goes down too. Signs and symptoms to watch for. Now let's talk about the signs and symptoms of dehydration, because this is really important. Catching it early can prevent serious problems. Some of the early signs include dry mouth and dry lips, feeling thirsty, although remember, older adults may not feel this, dark yellow urine, urinating less often than usual, feeling tired or weak, headaches, dizziness, especially when standing up, and dry skin that doesn't bounce back quickly when you pinch it. As dehydration becomes more serious, you might see confusion or trouble thinking clearly, rapid heartbeat, low blood pressure, sunken eyes, very little or no urination, extreme weakness, and in severe cases, fainting or even unconsciousness. One thing I really want to highlight is that in older adults, confusion and sudden changes in thinking are often one of the first noticeable signs of dehydration. So, if you notice a parent or grandparent suddenly seeming more forgetful, disoriented, or just not themselves, dehydration should be one of the first things you think about. It's often mistaken for dementia getting worse, but it can sometimes just be a sign that they need more fluids. Falls are another big concern. Dehydration can cause dizziness and low blood pressure, which increases the risk of falling. And falls in older adults can lead to serious injuries like hip fractures, so this is really not something to take lightly. How dehydration is diagnosed. So how do we diagnose dehydration? In most cases, your doctor can tell just by talking with you and doing a physical exam. They'll look at things like blood pressure, heart rate, the moisture of the mouth, skin elasticity, and overall appearance. If needed, your doctor may order blood tests to check electrolyte levels, kidney function, and how concentrated the blood is. A urine test can also show how concentrated the urine is, which gives a clue about hydration status. In more serious cases, especially in the hospital, more detailed tests may be done to figure out the cause and the severity. Health consequences of dehydration. Now let's talk about why this really matters. The health consequences of dehydration in older adults can be very serious. Mild dehydration can cause fatigue, headaches, and difficulty concentrating. Moderate dehydration can lead to urinary tract infections, kidney stones, and constipation. Severe dehydration can cause kidney failure, seizures, low blood volume, which we call hypovolemic shock, and in the worst cases, it can even be life-threatening. Dehydration is also linked to longer hospital stays, more complications during illness, and a higher risk of death in older adults who are already dealing with other health issues. So keeping seniors well hydrated isn't just about comfort, it can literally save their life. How dehydration is treated. Let's talk about treatment. For mild dehydration, the answer is usually simple. Drink more fluids. Water is great, but for older adults who have been losing electrolytes through sweating, vomiting, or diarrhea, an oral rehydration solution or a drink with electrolytes can help replace what's been lost. Things like low-sugar sports drinks or pediatric electrolyte drinks can be useful. Broths and soups are also a wonderful way to get fluids and a little sodium at the same time. For moderate to severe dehydration, medical treatment is often needed. This usually means going to the hospital or urgent care, where fluids can be given through an IV. IV fluids work quickly and can correct the problem much faster than drinking. The doctors will also check electrolytes and treat any underlying cause, like an infection or a medication issue. If dehydration was caused by something specific, like a stomach bug, a fever, or a new medication, that root cause needs to be addressed too. Sometimes adjusting a medication dose under a doctor's guidance is part of the treatment plan. Tips for preventing dehydration. Now let's get to the part I love the most, which is prevention. Because the truth is, most cases of dehydration in older adults can be prevented with just a few simple habits. First, drink fluids regularly throughout the day, even when you don't feel thirsty. A good general goal is around 6 to 8 cups of fluid a day, but this can vary based on your health and what your doctor recommends. If you have heart failure or kidney problems, your doctor may want you to drink a specific amount, so always check with them. Second, keep a water bottle or glass of water nearby at all times. If it's in sight, you're more likely to drink. Some people set a timer or use an app to remind themselves to drink every hour or two. Third, include foods with high water content in your meals. Watermelon, cucumbers, oranges, strawberries, lettuce, tomatoes, soups, yogurt, and gelatin are all great options that can boost hydration without you having to drink more. Fourth, limit drinks that can dehydrate you, like alcohol and very sugary drinks. Caffeine in moderation is usually fine, but a lot of strong coffee or tea can have a mild dehydrating effect. Fifth, if you take medications that increase urination, talk to your doctor about the best schedule for taking them and how to balance your fluid intake. Sixth, monitor the color of your urine. A pale yellow color usually means you're well hydrated. Dark yellow or amber means you need more fluids. And seventh, if you're caring for an older loved one, gently remind them to drink. Offer fluids in different forms, like smoothies, popsicles, herbal teas, flavored water, or broths. Making it enjoyable goes a long way. Managing hot weather and heat waves. Finally, let's talk about hot weather and heat waves, because this is when dehydration becomes especially dangerous for older adults. During hot weather, try to stay indoors during the hottest part of the day, usually between 10 a.m. and 4 p.m. Keep your home cool with fans, air conditioning, or by closing blinds during the day. If your home gets too hot, consider going to a cool place like a shopping mall, library, or a community cooling center. Wear loose, lightweight, and light-colored clothing. Drink water before you feel thirsty, and avoid heavy meals that can make you feel hotter. Take cool showers or baths if needed, and use damp cloths on your neck and wrists to cool down. Check on older neighbors, friends, and family members regularly during heat waves. A simple phone call or visit can make a huge difference. And if you ever notice signs of heat exhaustion or heat stroke, like confusion, very high body temperature, hot, dry skin, rapid pulse, or fainting, call 911 right away. Heat stroke is a medical emergency. So, to wrap things up, dehydration in older adults is common, but it is also very preventable. The key is to understand the risks, watch for the early signs, and build daily habits that keep fluids flowing. Don't wait until you feel thirsty. Drink throughout the day, eat hydrating foods, be careful in the heat, and stay in touch with your doctor about your medications and your overall health. If you found today's episode helpful, please give it a thumbs up, share it with someone who might benefit, and don't forget to subscribe so you don't miss the next one. Taking care of our older loved ones and ourselves as we age starts with small steps, and staying hydrated is one of the simplest and most powerful ones. Thank you so much for spending this time with me today. I'm Dr. Emily, and I'll see you in the next episode. Take care, stay healthy, and stay hydrated.